It's a Friday morning in the middle of summer, but people from all over Charleston and Tallahatchie County are stopping by the cafeteria of the high school. Because they want some things to change.
Lose some weight, lower my blood pressure, cholesterol.
This is registration day for the latest wellness challenge. It's a 3-month emphasis on how to get and stay healthy, how to eat, how to exercise.
It's not about being skinny, it's just about getting fit, taking charge of your health.
The Wellness Challenge is sponsored by the Wellness Center at the Tallahatchie General Hospital. Catherine Woodyard is the executive director of the Wellness Center.
We're only as happy as we are healthy, and health is our greatest form of wealth. And without our health, we have nothing.
The Wellness Center itself is an outgrowth of some changes that have taken place at the Tallahatchie General Hospital over the past few years. A shift in ways of thinking, emphasis on the patients and their families and the well-being of the whole community. And the area where they're located, the flat, impoverished Mississippi Delta, has more than its share of people in poor health.
Have a lot of diabetes, hypertension, heart problem, a lot of obesity.
Tallahatchie General Hospital Administrator Jim Blackwood recognizes the responsibility his facility has to serve the people where they are in the Mississippi Delta.
This is one of the sickest communities in the state and the highest incidence of chronic disease. So what we're doing as a hospital, it's just really part of our responsibilities to try to do something to reduce the incidence of chronic disease. It's also much more cost-effective to try to stop something like that before it becomes more expensive to treat down the road, and that's just kind of part of our mission as a primary health care provider.
But in order for the hospital to start making these outward strides to help the health of the community, it had to do some healing of itself first. A process that began when the county hired Jim Blackwood and the Sunflower Management Group to manage the hospital. The building needed repair and updating. The rooms were small, and there were way too many of them for the mandate the hospital had been assigned.
This hospital is a Hill-Burton-era hospital that had 40-something rooms, but as a critical access hospital, we couldn't have more than 25 beds. So we expanded the size of the room and created a really nice, aesthetically pleasing room, and that got us started.
Then came new equipment. This is before and after shots of the X-ray room and of the CT room. Then came a general paint-up, fix-up all over, a new look for the corridors and the patient rooms, a new look for the exterior, and new landscaping. And then, as a byproduct, new attitudes started taking over the people who work at the hospital. And more patients started coming here rather than going to out-of-town facilities.
When I first walked into the hospital, I was amazed at how clean it was, how nice it was. I had been here previously, maybe 3 or 4 years before I started working here, and had visited doing some marketing for Grenada. And when I walked in, it was not the place it is today. So I know the management group has done a really great job. I've seen the before and the after.
I see the place blossoming like a spring flower. It's everything that's happening is very positive.
Since I've been here, the patient census, which is the number of patients we have on a daily basis, has increased. We've gone from having 4 to 6 patients a day to almost reaching capacity the last few weeks.
The community started taking notice of their hospital. Tallahatchie County Sheriff William L. Brewer Jr. sums up the feelings of the people of the area.
For a little small town like us, we're blessed to have it.
And not only has the hospital perked up, but so has the extended care facility located here. And a part of that is providing a service not readily available elsewhere.
We recognized in the market that there were some nursing home residents that didn't fit your typical nursing home mold, folks that have dementia and Alzheimer's and that type of thing. So we set up a program specifically for those types of patients.
Johnny Darby is the administrator of the extended care facility.
The residents are happy. The staff members are happy, as well as the family members.
It's been a life-saving event for me to be able to be here. I really love it.
And the philosophy of customer care has had a byproduct with the staff. From doctors and nurses and custodians, they all now understand their place on the team. And Administrator Jim Blackwood's open-door policy of insisting that anyone bringing him a complaint is also required to provide a solution has given the staff a feeling of ownership in what they do and made them a family.
Everybody works very well together. It's a wonderful, wonderful environment to work in.
Everybody's just been great, and they just want the best for the patient, and that's just one of the unique things that I've seen here.
We just have a family up there that we work with.
We all share, we all have personal things together. We had a little shower here yesterday for one of the girls. Just wonderful people here. They all get together to help each other. And I think that's part of the successful story here.
That brings us back where we started, the Wellness Challenge, and the commitment the hospital has to the community to keep it healthy. And that's not just so many words. The hospital's already cleaned up and spruced up and modernized. And that's just the start.
They've remodeled it, and it's a beautiful building, and inside, outside, and then they're fixing to show us do some adding on down there.
And the adding on going on? Where this land is being prepared will be the permanent home of the new Wellness Center, an opportunity made possible through the generosity of Jim Kennedy, chairman of Cox Enterprises.
It can't just be a gym. It can't just be, a healthplex where people go work out. There has to be education on food choices and on diet and on exercise, and there's a youth component to it.
Education and commitment isn't a problem in the Wellness Center. Husband-wife team Lawrence and Natalie Morocco sees to that. As they call themselves, she's the researcher and he's the enforcer.
I want to bring happiness through fitness, and it's really simple, that simple. So anything I can do with fitness to bring happiness, that's it.
It's a commitment by Tallahatchie General Hospital to the community for the long haul, and it's already started showing results.
The management team, the group that we have there, have just done wonders for the community.
They brought some expertise with them, and with the people they brought in and with the people that we already had there, it seemed like things just went a lot smoother, and everybody's job, you were busier, but your job got easier.
Come and make our TGH your TGH.